Okay, welcome everybody. We're excited to have you here and talk a little bit about the Master's in Clinical Psychology program here at SF State. This program has been around since the early 1950s actually, and been ongoing. It's a wonderful program. We're excited to tell you all about the things that we are doing here. And myself and two of the faculty members will be presenting on the sort of the structure of the program to give you a sense of what it's all about. And then we'll have time for questions as well. So what is the MS in Clinical Psychology at SF State? This program is a 2-year full-time training program, training individuals with trained clinical supervisors. And this program basically is a practice-oriented program. It's here to help people learn how to be professional mental health providers. And we, as a program, actually have the academic preparations for the MFT licensure. This is a hands-on clinical practice program where you get exposure to a wide range of clients, different psychological frameworks or theories. One thing that we should say at the start is the academic preparations align with the California Board of Behavioral Sciences MFT licensure, which means that the curriculum meets all of the criteria for that. And sometimes this can be really confusing. The MFT licensure, marriage and family therapy, it sounds like you just do marriage and family therapy, but that's actually not true. If you talk to anybody in the field, you'll know that it's a label more than it is actually the specific content. So people do obviously work with couples and families, but they also work with children, and they work with adults, individuals as well, and groups a little bit. So the label is a little confusing. So I'm gonna move my little screen here so I can see my slides a little better. There you go. Okay. This is a rare 2-year program that meets the educational requirements for the MFT licensure. And by rare, it's because we put 60 units into 2 years. And so it's an intensive 2-year program. Our approach itself emphasizes the theoretical and applied training from a variety of perspectives. But we really emphasize on learning by doing. This is really, we think about the idea behind psychotherapy and being a mental health clinician is you really have to do it to learn it. So we start you very early on in clinical work. Our theoretical emphases are, I think there are many coming from several different angles, including relational approaches. So we base our work in attachment interpersonal theories. We really come from the perspective that to be a good mental health clinician, you have to be able to form a strong therapeutic alliance. And so that's really the foundation of our approach. We also train you in developmental psychodynamic approaches, family systems, and cognitive behavioral, among others. Along with that, I would say, and I think all of our faculty would agree, that our coursework and our practice is infused with an anti-racist, multicultural, and trauma-informed framework, meaning that all of these aspects are crucial to being solid mental health clinicians. And so everything that we teach you, everything that you do is coming from this angle. All right. The approach itself, we have a cohort model. It's 8 students per year who move through the 2-year program together. It's an intensive program, and we start you right away with clinical training. So it begins in that first year. Within the first 3 weeks of starting the program, you have clients, you work in a community mental health setting, and it happens very quickly and very intensely. Your training and supervision is done by core faculty, as well as adjunct supervisors. And then you get training in the first year, you have an experience in the on-site psychology clinic, which is right in the second floor of Ethnic Studies and Psychology building at SF State. And then you also are off-site in a community placement at Edgewood, which I'll talk about in just a moment. The coursework should align with this, meaning that in a sense you have basically in your 2 years, you have structured courses around all the things that I just described. So in your fall semester, you're taking a number of classes. You're taking an assessment class, clinical methods assessments. You're learning all about assessments. You're learning about the practice of psychotherapy. This is where we really talk about what does it mean to be a therapist and how do you actually become a therapist. You take a case conference, which accompanies your psychology clinic experience, which helps you talk about cases and understand how we work from that. And then finally, you have a theories class. This pretty much replicates in the spring semester. All these classes are year-long classes with the same students, small classes and very close attention to detail. The only difference really here in the spring semester is the assessment class becomes a drugs, brain, and behavior class in the spring semester. The other classes just continue on through the spring semester. In terms of the clinical practice piece, in your first year, you are providing individual psychotherapy to adult clients in the clinic. You're assigned individual clients, like I mentioned, in that first 3 weeks that you're here, and you have weekly individual supervision with a licensed faculty member here. You get an additional 8 to 10 hours placement at Edgewood. Currently, we're at Edgewood Center for Children and Families, which is a community mental health placement, just for residential treatment for adolescents. And there you get weekly group supervision as well. So you get this nice kind of balance between the individual psychotherapy that we're doing with adults, and then also working with adolescents who are dealing with other kind of crisis-related issues and other emotion dysregulation problems by and large. The second year in the program is also structured with those same 8 students that you've been in the first year. Now you're in your second year. And in this way, you have fewer courses. You're in the first semester, you're doing diagnosis and advanced psychopathology, along with a conference to accompany the psychology practicum. This is a seminar class that basically helps you kind of deepen the knowledge that you've had from your first year and thinking about the work that you're doing in your second year and sort of folding that into additional theory and practice. And then we have a seminar on selected problems in the fall semester, which focuses really on what you're interested in, some specific interests that you can bring into the program, since there are so many topics, obviously, in this field. In this spring semester, there's some differences. So in the spring semester, you're doing short-term and marital family systems therapy and theory, along with that continued 828 conference class that I mentioned. That continues over into the spring semester. Finally, you're doing a directed reading and comprehensive written examination. What this is basically is a master's paper. Over the course of your second year, you're writing a master's paper, and that culminates in the paper that's due at the end of the spring semester. All right, so what else is going on in the second year? It is you're involved in a 20-hour-a-week placement in a community-based setting. This can be in a clinic, can be in a hospital, can be in a variety of different settings. But basically, you apply for these in the spring of your first year. At the beginning of the spring semester, you're already looking to, what do I want to do in my second year? And lots of folks go in lots of different directions and apply throughout the Bay Area based on where they want to be and what population they want to work with. And then you have that culminating experience project called the master's paper, which really, what that is for most people, it's applying a clinical theory to a specific case study of your choosing. That's usually how that's done, although there's some flexibility on the content of what you can do. All right, so kind of big picture. I think you probably are getting from just this little presentation that it's a full-time program. It's a lot. It's at least 40 hours a week. And there's this emphasis of learning by doing. We throw you right in, give you a lot of support. You have a ton of faculty members to talk to and work with, supervisors, you have your cohort, you have people that are either senior to you in the second year or postmasters to sort of get information from, but it's an intensive program. The curriculum, which I sort of mentioned, but I want to re-emphasize this, it's infused with cultural, social, racial diversity, anti-racism, and really focused on trauma-informed clinical practices. This is a major part of the program in every class. It's not like you have one class on this. This is like every class is infused with these ideas. I say that one of the things about this program is it's small enough that we know everybody that's been through this program. So in fact, when people say, oh, I know somebody who went through the clinical program at SF State, I'm like, oh, who was it? Because I'll know them. If they graduated in the last 20 years, I know that person because we really value our relationships with our students and our students really learning and developing as mental health clinicians and learning in a way that allows them to go out and work with a variety of populations, people with severe mental illness, working in community mental health, working with the LGBT population, BIPOC communities for sure. This is all part and parcel of what we do in this program. And like I mentioned, you get started right away with intensive, varied clinical experiences. And that really kind of brings us to the next step, which I'm going to head over to Dr. Liu, who will tell us a little bit about, all right, so how do you apply? What do you do?
Yes, thank you, Dr. Gard, for introducing our program in a general way, and then hopefully you have a good understanding of what our program is offering. So first of all, excuse me for my voice. I'm not feeling 100% well today, but I'm gonna cover what many of you are curious about, right? Like, how do we apply for this program? What do we need to apply? And also wanted to say welcome everyone to our open house tonight. Okay, so our program, right now we only admit students during fall semester. So because again, like Dr. Gard was saying, we admit a cohort. So which means that it will be really hard for us to have students coming in from fall semester or spring semester or both. So right now we only admit students during the fall semester. So only one deadline for application, which will be February the 1st. And also, again, it's an intensive program. It's more doable if it's you're a full-time student. So the program needs to be completed in its full-time format. You're gonna take so many credits within 2 years. So that's the expectation for the program. Also, you will need to have a bachelor's degree to apply. And with any, there's no limitation on any field. It could be in psychology or any other field, can be related to clinical psychology, but you need to at least have a bachelor's degree to enroll in our program. So that's the overview. Let's take a look at, what kind of prerequisites you need before you apply or before you start a program. There are certain undergraduate courses that we want y'all to take before you start the program. There are 3 for our program, which are statistics. If you are a student at SFSU or you graduated from SFSU, there will be Psychology 371. And also, we want y'all to take the class Theories of Personality, which is Psychology 451 if you are a student or a graduate student from SFSU. And also Normal Psychology, which is Psych 452. So some students are asking, what if I'm still taking it as I'm applying, which is fine. You just need to complete the coursework before the program starts in fall. If that's clear. And if you have questions, you can email us too. Also, for most of our applicants, they all have certain type of clinical research experience in clinical psychology. For example, they have volunteered at a hotline, or they offer some crisis intervention at certain facilities, or they have been doing counseling-like services to the community. Or sometimes they had some volunteering experience at a group or a residential facility, or they are ABA technician. And we really hope that when you applied, there will be at least 1 year of clinical or research experience, or some experience that's related to clinical work. The reason before this is because we want you all to be sure that this is the field you want to be in, rather than just making a decision because you think that might be a good fit. And also, if there's any position you're doing, for example, tutoring or things like that, it's not directly with clinical work, but it's close enough, you can still use that when you apply for our program. So hopefully that's clear. So anything with you providing some type of emotional support for the individuals. So when you are applying, there are certain things that you will need, right? So when you go to the website, you will see the CSU application. There's different forms for you to fill out. You need to do that, and also prepare your resume or CV, just to list, what experience you've had in the past and academic courses you've taken or things related to that. And also we wanted to see the transcript showing that you at least have a 3.0 GPA for all your units that you acquired from your undergraduate university. And also you will need 3 letters of recommendation as well. It could be from your professors. It could also be coming from your supervisors if you're doing volunteering works. Okay. So also a lot of students ask me what's the most important thing. So all these materials are really important, but I think personal statement is something you really don't want to underestimate the importance of the personal statement, because it really shows to us, why you're interested in this field and why you think our program is a good fit for you. So really spend some time thinking about how you can demonstrate your readiness for graduate study and specifically convey that in a personal statement, and really try to tell us what motivates you to our field and what are the prior experiences that you've had that make you feel like this is the field that you feel passionate about. And also, if you can demonstrate your psychologically mindedness, so which means that you're able to conceptualize in certain things or people in a way that's psychologically minded, that's a good plus too. We wanted to see that in a personal statement. And always reach out to your professors if you need help with personal statement. They might be a really good source for you to get some feedback on that.
Great. Thank you.
Thank you all.
Thank you for doing that. I appreciate it, especially you're not feeling well. So we so appreciate you showing up and help and going through this part of the
Sorry about my voice.
No,
I thought
you're
it
great.
was
You're
better
great.
than this, but so.
All right, Dr. Wolf, you want to jump in there? Oops.
Yes.
If I can get the story there, yeah.
Welcome, everyone. We're really excited to have you. I'm going to finish us off with some frequently asked questions with the caveat that this is by no means exhaustive, which is why we're going to have some time for you all to ask questions, get your questions answered. So first, what is the full cost of tuition for this program? Roughly $19,000 overall. This is just focused on the cost of tuition. It's important to note. So this does not include any other expenses related to cost of living, housing, anything like that. Go to the next slide. Thank you. So I think this is a popular question we probably all get in relation to what Dr. Liu was sharing about the importance of having clinical experiences before you get to our program. Really, we want to see that you have some prior experience in the mental health field. We obviously temper those expectations with the knowledge that you all are, for the most part, undergraduate students who are, constrained by the level of training that you have, right? We wouldn't expect undergraduate students to be acting as psychologists or therapists. We also recognize that you may have a specific population in mind that you want to work with, that you may have not had a chance to do that into our program. So we're not expecting that you have like your ideal, clinical work or exact experience before you get into the program. But we do want you to have a year of some experience that prepares you to really hit the ground running, so to speak, because we do start you with clients really quickly. So for some students, that's being on a hotline or a warm line. We have a number of students who are doing applied behavior analysis work, working at VA hospitals. There are all kinds of things really that you can do. And I think it's sort of your job in your personal statement and your application materials to really kind of sell that to us in terms of why it's relevant. We'll have more time to talk about that tonight. And yes, obviously the Bay Area is exorbitantly expensive. We understand that necessitates potentially working full-time or part-time. We have a lot of students who ask about that and are interested in that. It's important to us that you all are fully informed of what you're getting yourself into. So our program is very, very intense. We have taken what is, usually a 3-year program and put it into 2 years. And given that, we don't recommend that our students work just because it's hard to do that in addition to our program. So we recommend that our students seek financial aid instead. And I would say that's what the majority of our students, if not all of them, do. Okay, this is our faculty for the program. So obviously Dr. Gard, Dr. Liu, and myself are all here tonight. We also have Dr. Hagan, Dr. Hawley, and Dr. Harris is half-time in our program and then half-time in the school psychology program. Dr. Liu and I are clinical supervisors in the program. So when Dr. Gard was talking about having clinical support from a licensed provider, Dr. Liu and I provide that for our first year students who are accruing hours in our